During the question and discussion portion, you will have the opportunity to ask questions and share your experiences or thoughts verbally. To let the moderator know that you want to ask a question or share a thought, please use the raise hand function. The moderator will then invite you by name to speak. To raise your hand, click on the Participants tab. In the Participants box, you will see a raise hand icon that you should click. Finally, if you're looking for more information on today's topic, be sure to take a look at the trending topic, which has a list of helpful resources. We will also post the link in the discussion forum on Springboard. Just like building a friendship with a person, developing a partnership with a community takes time. There are key actions you can take to help a fruitful relationship grow. For instance, if you hope for a broad community participation and engagement in your interventions, your team will need to carry out a number of introduction and orientation meetings prior to undertaking a baseline analysis or conducting any activities in the community. If communities do not know who you are or why you are there, it can result in miscommunication, mistrust, and potentially a security risk for staff. In our webinar today, Gail Snetro and Carla Sanchez of Save the Children will discuss how to develop rewarding partnerships with community. Gail Snetro is a senior advisor in community and social change at Save the Children, and Carla Sanchez is a senior specialist in behavior change and community health at Save the Children. I will now turn it over to Carla and Gail.
Hi, good morning, everyone. Thank you for joining us. And thank you, Tyler, for introducing us as well. I'm going to ask everyone to please mute your phones and your lines so that we can have a clear video and clearer sound. Okay, and I'm going to turn on the video so that you're able to see me and Gail for today. So thank you again. Thank you for joining us. Today you are joining us for the second in a four-part series of online discussions on community engagement. Today we'll be talking about effective community entry process, how to build partnerships with communities, and how not to. I am Carla Sanchez, Senior Specialist for Behavior Change and Community Health at Save the Children, and I'm joined by my colleague, Gail Snetro, Senior Advisor for Community and Social Change with Save the Children. You'll be meeting her and seeing her in a little bit. So during the series, we have discussed the importance of creating and sustaining an enabling environment for social change. That was the first one, and that video is available on Springboard if you wanted to refer back to it. Today, we'll discuss how to build partnerships with communities. Tomorrow, we will hold our third webinar, which is the same topic as today, but in French. So please spread the word to your Francophone friends and colleagues. And in September, we will discuss how to help communities identify their own problems on data and to monitor their progress towards improvement. So today we will start with a video where Gail will provide you with some information on effective community entry and how to build partnerships with communities. And after the video, we'll have about 20 minutes to open the floor to you, to ask us questions, to share your experiences, and then to also respond to some questions that we have for you. But before we start, we would like to ask you all to please take about 2 minutes to respond to our poll questions. We do have 3 questions for you. They are the same questions that we shared previously. This time, however, we would like you to rank. I'm going to launch the poll now, and then just please, again, take 1 or 2 minutes, and we will look at the responses after the video. All right, so the poll is on. Please take a minute to respond. Thanks. So we'll just take a few more seconds to ask that everyone to give a little bit more time to respond to the poll. All right, so I'm going to end the poll in 5 seconds, and we will look back at the results afterwards. So I'm going to go ahead and play the video now. So please enjoy. Actually, I'm going to turn off my video first.
Hello, and thank you for joining our webinar on effective community entry processes and how to build partnerships with communities. We will be discussing how to make community entry an important part of your program's success, how to work in partnership with communities, and how community entry sets the stage for ownership and more sustainable outcomes. Specifically, our objectives are to explore how we define community, participation, and partnership, steps to sound community entry, what we understand about community systems, how to build trust, credibility, and a sense of ownership, how to invite participation, and our own operational commitments to community entry. So let's get started. In this section, we're going to be setting the stage for community entry. We would like to spend a little time setting the stage for creating a common understanding of what we want to accomplish with community entry and partnerships. So what will be your context? Why are we entering this community or these communities? What are our reasons for being there? What will be your overall program approach? For example, do you anticipate applying a community mobilization approach? For Save the Children and many organizations, this entails strengthening community capacity to achieve a specific health goal through collective community action. Or is it your intention to undertake for a short time period some formative research or some social and behavioral explorations? Or is this an emergency response to a humanitarian crisis? Whatever the context, trust, transparency, and ownership appear to be woven throughout this process as keys to success. I will be approaching this topic from a perspective of applying sound community mobilization approaches to achieve program outcomes, and we invite you to reflect on your own programs and the approaches you are using. Issues that need thought and consideration at the beginning of this journey include: what is your definition of community? What level of participation do you anticipate? And what type of partnerships do you anticipate? Let's review these briefly. So how do we define community? In the changing context of migration, urbanization, and globalization, the concept of community has evolved significantly beyond just a group of people who live in a geographically defined territory or area. Today, the term community can also refer to social networks. Social networks are a group of people connected by a common characteristic, such as interests, age, ethnic origin, religion, a profession, the same language, or a shared health concern. As such, you may have teachers forming a community or a social network. You may have a social network of youth, or a community of people living with HIV and AIDS, a community of displaced refugees, or a community of teenage boys. Today, we will be referring to both the geographical and social network definition of community. So let's talk a little bit about degrees of participation. We reviewed under webinar 1 on community engagement the degrees of participation. We're just going to briefly go over it again now for those that did not join us. We know that participation is not merely an instrument to more effectively ensure compliance to reach our project goals, but in fact, it is a right of people and communities. However, we know that all participation is not equal. In this graphic, the social scientist Andrea Cornwall ladder of participation has been adapted, and you can see that there are a level of participations ranging from co-option, which is the lowest form of participation, to collaboration, all the way up to co-learning and collective action. Your project design should clearly reflect the level of participation you will plan for, as this sets the stage for the level of participation and partnership you want to establish and how you will enter communities. Let's also discuss some steps to community entry and partnership. So there are a number of steps which need to be considered when anticipating a partnership with communities. Many of these occur prior to entering a community. These steps can include selecting the health issue and defining the community, putting together a community mobilization team or a community engagement team, preparing your team for community entry, gathering information about the health issue, the community itself, and the resources and constraints you'll be working with, developing a community engagement plan, and then orienting the community to build trust, credibility, and a sense of ownership. And through that process, inviting community participation. And then identifying the core group you're going to be partnering with to explore, plan, and act together. And this would be a community core group. But much has been written on these steps, and we will include valuable references at the end of this webinar for your further reading. And I will be highlighting many of these key issues during this presentation. So now that you have set the stage for the type of communities you will work with, you've identified your community engagement or community mobilization team, and decided on the level of participation and partnership you will be working towards, it's time to roll up our sleeves and get to work. In section 2 of my presentation, I will share with you our learning on what needs to be done prior to entering communities. Some say that how you enter communities sets the stage for how you exit. Therefore, laying a clear foundation prior to entering communities requires careful planning and consideration. We will be discussing preparing your community engagement team, creating a mobilizing goal, understanding community systems, and the pre-entry meetings with community leadership. So let's start with preparing your community engagement team or your mobilization team. It will be important first to define who your team is. We have found it useful for a community engagement team or community mobilization team to first include program staff, as well as some government partners and NGO partners as appropriate. This will help inform your community entry, introduce you to community leadership, and serve as an advisory group to guide your community engagement and mobilization interventions. You'll see that this community mobilization team or community engagement team will come in handy when taking your first steps into a community. The community mobilization team or community engagement team is normally a group of 5 to 10 professionals. Once you have your team, it will be important to have them set their own norms. Such questions as, does this team value community insights and abilities? Or do they feel that communities have little to share as partners? How does this team feel about gender equality and women's and girls' positions in society? Will your team value and consider the opinion and insights from communities? We have found that setting norms for how they will work together or work with communities has been incredibly helpful. Here's an example from Malawi of a community mobilization team values. They included create and build trust in communities, do no harm, don't make promises that cannot be fulfilled, respect community members, ensure the broader community is well-oriented, know the programs and the program goal and your intermediate results, and be able to articulate them in local language in a way that is mobilizing to communities. We'll get to that just now. Admit when you don't know something and seek to understand. Understand your team's roles and responsibility and promote child participation. Now, let's look at some other preparatory work that you need to do with your team. And that includes ensuring that they have team skills and competencies. You can either hire these team skills or competencies or ensure that training is provided. Team members should complement each other with some of the following skills. We do not expect each person to have all of these skills. Some of the competencies a community mobilization team or community engagement team might have is that they will be politically, culturally, and gender sensitive, or transformative in the case of gender. They will have excellent communication skills. They will have the ability to listen. They will have participatory facilitation skills and use appropriate methods and techniques with communities. They will have a knowledge of the technical issue, the technical health issue. They will have program design and implementation skills. They will have organizational development and partnership skills, group organizational skills. They will be able to apply social and behavior change processes, including particular to your program, human-centered design, formative research, interpersonal communication, etc. They will have the ability to assess and strengthen community capacity. They can facilitate communities to better organize and explore, plan, and monitor their achievements. And they can build and link communities for improved participation, leadership, management, external linkages, resource mobilization, and use of data. That's a lot, I know. But again, with the proper training and when you hire the appropriate team or bring on partners from government or local NGOs, you can build a community engagement team that is ready to enter communities. One other thing we need to talk about in preparing this team is let's talk about first impressions. It might be good to have your team think about what they can do to make a first good impression with communities. Bad first impressions are difficult to overcome. So, who introduces you, what you wear, how you act, which language you speak, what you say, and how you say it will have incredible importance. Even how you arrive in communities, by car, by public transport, where do you park your car, etc. All these things will be noticed and discussed by community members when you leave. And if your team is not familiar with local community protocol, it is important to learn about it early on. You can talk with people who are working in the community or already, or who know about local protocol. And you can find out which people you need to contact first and what will be expected of you during that first visit. So preparing your team is a continual process actually throughout the life of the project. But there are a few other things that are critical for your team to understand and be prepared to do prior to community entry. The next thing is creating a mobilizing goal and being able to practice it together. It's interesting the number of field staff I come across that are not completely sure of the goal of the program. So first and foremost, we have found it useful to ensure that all levels of your team understand the program goal or the project goal. Because we want to build community participation in the program, it is essential that communities also understand this goal. Therefore, prior to entering communities, it's important for our team to be able to translate our technical goal into a goal that is motivating and easy to get excited about. On this slide graphic is an example of a technical goal. This is for school health and nutrition. The technical goal reads, increase regular access to micronutrient and deworming of school-age children in order to increase their cognitive performance in school. A more mobilizing goal may be Improve school-age children's health and learning achievements in school. Note, and this is really important, that it's important for your team to develop their own motivating goal that they all will agree on, and that reflects the project and the program. And it's important for them to translate it into local language. Yes, it's a harder exercise than you think. Additionally important, prior to entering communities, is understanding community systems. What do we know about communities and what don't we know? What we do know is that communities can be complex systems of social networks, groups, power bases, cultural and traditional norms, and groups and individuals with capacity strengths as well as needs. So before fully entering into a community, your team will need to first learn about communities. Some questions they can ask and learn about include, how is the community organized? Who holds power and authority? This includes understanding both the political authority as well as traditional authority. What is the traditional organizational structure, in a community? Who leads this traditional organizational structure? Who are the formal and informal leaders? What do we need to know about social class, ethnic groups, and the languages spoken? What are the traditional groups and organizations that exist and their role? Who is affected by the health issue that is our focus? And who are the most marginalized in these communities and why? Other questions to ask include, when was the community established? What has been its history of collective action? And what are its available resources and capacities that can be built on? These are just some of the questions to get us started towards a better understanding of community systems. Let's briefly take a look at some tools and techniques to help us learn about communities. Some you might already be familiar with, so I'm going to move through these pretty quickly. Again, there are multiple resources on these tools, and I have provided these at the end of the webinar. One simple tool that is easy and quick to use is the Venn diagram, which helps to identify interconnectivity between groups and sometimes between people. You can undertake spatial maps. You can map community capacity and resources. You can undertake key informant interviews to understand some of the questions we discussed previously. You can take a transect walk, which with community members, you would walk across a community to get an understanding of where people live and what their resources are. You can undertake a gender analysis. You can also carry out historical profiling and visualization. There are many, many tools that can be used to understand and learn about community systems. Many of these can be found through participatory rapid appraisal techniques and other participatory techniques. The last thing I'd like to talk about in this section around preparing to enter communities, what you need to do prior to entry, is that in fact, at this stage, you will be, when you're ready and when your team is ready, having pre-meetings with community leaders. So when community mobilization is initiated by an external organization, the first action would be to meet with community leaders to determine whether they're interested in participating in the project or the program, and to begin to establish a working relationship and set a tone for possible partnership. Note here that it's really important to harness one of your community mobilization or community engagement team members, possibly from local government or a credible NGO, to help your team make these introductions. It's much easier than going in cold as an external organization. That is contingent, of course, on making sure that these individuals have credibility and are trusted. You will also want to discuss with these leaders how you propose to learn more about their community and some of the tools that we just spoke about in order to learn more about communities. So the learning would start together. So at this stage, these community leaders have a particular role, and you would like to speak with not just the formal leaders, but also the informal leaders in order to make these initial introductions. The formal leaders are who? Well, they could be your village headman, or village chief, or chieftainess, your village counselors, politically appointed leadership, or a community chairperson. Informal leaders, often equally as important, may include wise elders, women and men, faith-based leaders, traditional healers, traditional birth attendants in their non-delivery role, and perhaps school principals or headmasters or headmistresses. Again, there are a few things that you want to consider when making initial contact with these leaders, both formal and informal, at the community level. You will want to know local customs and protocols for meeting these leaders and follow these protocols. You want to ensure that someone on the team speaks the local language and dialect. You want to prepare materials prior to your visit, maybe a short description of the program, the project, some information on your organization, and some interview guides if you want to use them. Be sure to ask if you can interview them. You might need to do that at your second meeting with the community leaders. You need to be respectful of people's time and their schedule, show up on time. You need to be honest, and again, don't promise things that you can't deliver. And you need to decide on the type of first impression you want to make as you step into communities. In this section 3 of my presentation, we will take a close look at actually entering communities and establishing a partnership. This will include community orientation, building trust, credibility, and a sense of ownership, inviting participation, and identifying a core group or core groups to establish your partnerships. So let's take a close look at community orientation. An important step to inviting participation and partnership will be orienting the community to the program or initiative. You will need to carry out a number of introductions and orientation sessions in order to begin to build your community partnerships. If communities do not know who you are or why you're there, it can result in miscommunication, mistrust, potentially a security risk for staff. Let's look at some of the benefits of community orientation. Community orientation can provide an introduction and background to the program or the project and the partners involved, namely yourselves or external organizations or perhaps local organizations. It can share important health data on the issues that the program is addressing. It can present the mobilizing goal. The team can begin to learn about the health issue from the community itself. It can motivate interest. You can receive a formal or informal consent to work together through community orientation. Community orientation can also provide for communities a brief description of the approach you're going to be using, whether it be community mobilization or other approaches. And it sets up the expectation for partnership, for co-learning and collective action, if that is the level of partnership you would like to achieve. It also provides an opportunity to invite participation. Community leaders and informal groups whom you have met during your initial meetings with communities can help to orient communities along with your program. They can help introduce the program. They can help introduce your team. They can begin to take ownership over the program by participating themselves as community leaders in the community orientation process. Remember, community orientation is a process that can help establish trust, transparency, and a sense of ownership. Planning for and being prepared for community orientation sessions is essential. Some possible topics for a community orientation meeting could include introducing participants and your community mobilization team to the community. You could share the mobilizing goal. Again, you can share data on the health issue as it affects the community. You can ask community members, does this health issue affect you and your family or the community at large? You can discuss the role of the community in the program. You can introduce government initiatives and what partners at the community level can do and partners at the district level can do to support the program. Discuss how communities want to work together, including how they want to own and participate in the program. And at community orientation meetings, you can invite participation of those most affected and interested in the health issue you are trying to address. Now that your team knows how the communities are organized geographically and traditionally, you can develop an orientation schedule with responsible point people to ensure that the broader community is oriented to your program. Remember that people can decide whether to attend the meeting or not. So be careful on who is inviting community members to participate. Make sure that they are credible if they are community leaders, traditional leaders, or more formal leaders. Remember, even if you've already been working with this community on another program, it will be important to continue to introduce the community to the new program and perhaps to your new team. Community orientation normally is undertaken at multiple levels to ensure that there is maximum understanding and broad participation. So an example of this is from one country where community orientations were first initiated at the district health office level and followed by meetings with traditional leaders and sub-traditional authorities and with village heads and finally with the broader community, school teachers, headmasters, local health providers, education providers, community health workers. Interestingly and importantly is that district health officials were part of the community engagement team or the community mobilization team. So they were extremely helpful in orienting communities at multiple levels. When planning for community orientation, it is important to consider who to invite. Normally, it's those most affected and interested in the health issue, including could be women of childbearing age, could be grandmothers, grandfathers. It really depends on depending on the size of the population and the communities you are covering and the partners that you're working with, the orientation process can take up to 2 to 3 months. While this may seem time-consuming, it should be considered part of sound community entry, and it will provide a foundation for understanding, ownership, and interest in the health issue and the health goal being addressed. So it's time well spent. Let's move on to building trust, transparency, and a sense of ownership. Remember, the community orientation process is only one opportunity to establish trust, create transparency, and a sense of ownership. Other strategies might include identifying a community event your team can participate in. This might include a sporting event or a community market day. The activity might have nothing to do with health. Be sure to establish meeting times and places based on community members' availability and their local calendars, taking planting and harvesting season into account. And make sure times are when people are most available. Ensure that your team communicates to the community consistently on the program and the program strategies. Inconsistent communication quickly translate into community confusion and distrust. Make sure your team apologizes and accepts responsibility when mistakes are made or when promises are broken. Here's an example how a community mobilization team in Mozambique built trust when entering a community. They looked at appearances, and they also looked at the importance of being on time and to speaking in local language and wearing the appropriate clothes for the field, not necessarily wearing sunglasses. Cell phones were a no-no, especially during meeting or even texting. The Save the Children Park vehicle, in this case, they made sure it was parked at a respectful distance to community leaders and to homes. And there certainly was no smoking or drinking allowed. Let's move on now to inviting community participation. Early on in your community entry process, your team is going to need to identify those people or groups who are most affected and most interested in the goal that you are trying to reach, in the health issue that you are trying to address. These people are most directly the ones that feel the effects of the problem and who need to be involved in finding appropriate solutions to the problem. So we are building this partnership right now. You may want to consider those who also have successfully dealt with this health issue, those who had positively responded and addressed creative ways in their own family and communities to address the health issue. So the cup is not always half empty. Often it is half full. Particularly when people are at higher risk of being affected by the health issue or are marginalized, those are the very people that we want involved in our community partnerships. To that effect, it will be important to proactively identify those who will not immediately come forward for a variety of reasons. It will necessitate our teams to really reach out through community groups and through leaders to find those most marginalized and to intentionally invite them to participate. We know that true participation of marginalized groups, rather than just token participation, is important because research indicates that those most marginalized need to be present in community participation. So we look at ensuring that at least 60% of those that are participating are those most affected and most interested in the health issue, because then the solutions found will be ones that are appropriate to their realities. Let's now turn to identifying a community core group in order to initiate our partnership with community or solidify our partnerships with community. But what is a core group and why are they important? A core group is a group of individuals that is most interested and most affected by the health issue you are trying to address and who would like to work together to address this health issue. The core group acts as an engine to increase participation of the broader community around the health issue. Again, it is made up, hopefully, of 60% of those most affected, most marginalized, and most interested in this health issue, so that we can assure that their voices are heard and that the priorities that this group help to set are based on their felt need as well as their capacities. The core group is responsible for carrying out community collective action and continuing to explore the health issue, plan, and act together. It goes on to monitor and share results with the broader community, and it's usually made up of 15 to 20 members based in the community. It is usually preferable to start with a small group and a committed group rather than a large group, because you really want those that are most driven to address the health issue and are not looking for incentives or motivations to come together. Development agencies have tried multiple approaches to identifying and partnering with appropriate core groups. Many times, core groups already exist in the community, but they are possibly not highly functional. These could be various committees, such as health committees, community-based organizations. We look towards, again, identifying those most affected and interested in the issues, and if they are not already organized, we help to facilitate their organization or their revitalization if they are an existing group already, but that is not fully functional, like a health committee. Working with existing groups can be difficult, so often people decide to start a new group. This has its challenges as well. So your community mobilization team will need to think very carefully about the pros and cons of starting a new group or working with existing groups in the community. Your team will also need to look at the barriers to participation and for community members not wanting to participate in the core group or in activities planned by the community, by the core group. And you need to develop strategies to overcome the barriers to participation. Please note that the identification of a community core group is only the beginning of establishing a sound partnership with communities. More is required to explore and plan and act together with communities, and we will hopefully address this in future webinars. We will end this presentation with section 4, our operational commitment to community entry and partnerships. Learning from successful programs indicate that sound community entry can take up to 3 months or longer. But the payoff, again, in laying the proper foundation for community participation is great in terms of program outcomes and community partnerships. So, how do you plan for and budget time for community entry? What has been your experience advocating for the time to do this well? We have scheduled time for questions and comments. Mostly, we would like to hear from you and learn from you about your experiences entering communities and creating partnerships. What have been your successes and your challenges? Are there processes you did not hear in today's presentation that you've used? We would like to hear from you. We will also take a look at your responses to the questions posed on the invite to this webinar. Thank you very much.
Okay, thank you, everyone. I'm going to go ahead and, I'm going to go ahead and firstly show you. What is this? No. I'm going to go ahead and show you a list of references that we have. That we will share with you on the Springboard Forum platform afterwards. And just a reminder to please also continue to check back on the Springboard platform just to continue your discussion beyond today's webinar. Okay, so we have a few for you here, which we will again post online. And we're going to dive into opening the mic with everyone. But before we do that, I wanted to share back the poll questions that we had. And I'm going to go ahead and share our results here so that we can take a look. So how significantly is the community entry phase reflected in your program work plans? And 35 said very significantly. So that's good. That's the majority. But there were still 15% that was kind of on the lower end, 25% in the middle, and 25% also a little bit high. How do your programs value community partnerships? The majority, 40%, said very highly valued. No one said not at all, so that's good to hear. It's good to know. We also asked, how do we really rate the importance of community participation in achieving a program outcome? And again, the majority said very high. So that's really good to hear as well. So now I'm going to go ahead and show you our questions that we have. You're going to have to bear with me as I try to do this in addition to managing our participants. So can you see that okay? Let's see. So I'm just going to go ahead and pose these questions, and I'm going to ask whoever is interested in responding to please either raise your hand and I will unmute your microphone so that you can speak, or you can also feel free to go ahead and enter your comment into the chat box. So we just have a few questions for you here. I'm going to try to maneuver a little bit here. So feel free to answer any of these questions that you are interested in. There's no particular order, but I'll just read them out loud to get us started. How do you plan for and budget time for community entry? What has been your experience advocating for the time to do community entry well? What has been your experience entering communities and creating partnerships? What have been your successes and challenges doing that? Are there other processes that you have used different from what we presented today? And any other general questions you have for us. So I'm going to go ahead and let you all raise your hands if you would like to respond to any of these questions or to ask us your own questions. And you can also, again, feel free to enter your responses into the comment box. Does anyone have any questions for me or Gail?
There were a couple of questions in the chat box regarding payment of the core group. There was another comment about working with women. If you'd like, I can respond to that.
Yeah, go for it.
First of all, thank you all for joining us. And I really enjoyed the chats so far. With regard to really engaging women, absolutely, they are what we would consider, and depending on whether they're a formal leader or an informal leader, they are incredibly important. I think the issues to keep in mind with only engaging women is that you have to think about when you are not engaging particular power structures, how is that going to affect community collective action and broader participation? So definitely, women are incredibly important. They often are part of your formal leadership. They are also considered informal leaders and take very, very important roles in the community. Briefly, on the amount of work that a core group might have, and I think there was a comment about paying them. I think probably many of you on the line have a lot of experience with this. We really do try and make sure that their roles and responsibilities as an engine for moving forward this partnership and broadening participation is clear, and that they harness not just members of the core group but the broader community so that their workload is not so great. One has to be very, very cautious if you're using an existing structure such as a health committee, which is formally recognized and that often are not paid. So incentives might be a great topic for a whole other webinar, but one has to be very, very cautious. And often I have a lot of learning about incentives, oftentimes training and certificates, et cetera. And again, being very careful about their level of effort is important. I'm going to stop there for other questions.
Hi, Gail. Hi, everyone else. There was a question earlier around 10. And that was, let me see if I can find it. What are your thoughts on challenges in integrating into community with humility, especially when Moors may be totally different from that of Western thinking and at times at odds with such?
I saw that comment and really appreciated that. And I think this has to be addressed with your team before entry. And it comes with all of those skills and capacities. Humility is a really tough one that we often come across, because chances are we already have more formal education. But again, asking your team those questions about how do we value community knowledge? How do we value community input? How do we value community capacity is one way to try and gauge the humility factor within your own team, and to create a dialogue of knowledge that is real and meaningful. It's often one of the toughest issues to overcome with ourselves and with our own teams, external teams.
Thanks, Gail. We also have a comment. It wasn't a question, but a comment. I work with the Comprehensive Rural Health Project, Jamkhet, India. Their approach is to be invited into the community and assure its cooperation, then to assist the community with their interests first as a way of building relationship and trust instead of imposing a project the agency is interested in. As the staff get to know the community, they identify what they call socially minded people, who are the key people in the community that the staff can work with and helps build relationships and trust. Thank you for that comment, Connie.
It's great.
Here's another comment. Great. Yeah. If there's, which one? Okay. Sorry, it's moving. Thanks for an excellent webinar. Well, thank you, Eidos. My question is, could you share your experience with knowledge management on community partnerships? How do you institutionalize it at your organization?
That is an excellent question. And again, trying to build in monitoring community engagement and systems into your PMPs or your indicators. We have tried to is community participation an outcome in itself, or is it just a process to get to your outcome? Is community capacity a outcome in itself, or just a process? Again, another topic for another webinar. I think the more you can build in indicators, whether they be process or outcome indicators that are tracked formally into your program systems, the better.
Thanks, Gail. We have another question here from Sarah. In trying to include marginalized groups, do you ever encounter a situation in which people from the broader community don't want to be at a meeting in which the marginalized people will be present?
Absolutely. And we didn't talk a lot about trust and safety, but we did talk a bit about trust, but one of the ways is understanding who's coming together in that particular meeting. And this is a tough issue, and it takes time. Oftentimes you start where people are at. So if you need to first work with that group that is, as you're mentioning, might not be so marginalized, and getting them on board on what are the issues within their community, and attracting the right people to that conversation, who will then be able to say, okay, if we are going to address this issue, then we really do have to sit and work together. So it's not forcing people together. You might need a number of initial meetings to understand what you're trying to address, and through that goal, bringing those groups collectively together. It might be where you have to work separately for a while, and I understand that question, but I think the idea is to create networks and social cohesion through your community mobilization processes. That's sometimes the outcome, the unexpected outcome of these processes. But again, we understand that these things can't be forced.
Thanks, Gail. We have another question from Edward. It is very important to give voice to women, otherwise issues affecting them will not be adequately addressed. In Ghana, we pay particular attention to women when engaging communities in order to give them a voice. So that was just a comment, not a question. Thank you, Edward. We have another question from Dorothy. Working with core groups is very important. How do you ensure that they are fully committed to work according to work plan without stipends?
Great question. Often we have people show up, or let's say it is an existing core group who have because we might be external or there's a new project, there's going to be expectations. And we have found that as we are very clear about the type of partnership that we hope for and the type of ownership that we're trying to inculcate in communities, often folks that are expecting some type of remuneration fall away. Inviting those that are most affected and most marginalized to begin with is really the key on this, because even if it's a small group of people initially, they're not necessarily looking for remuneration, is what our experiences have found. And then you slowly build that group up. So I hope that partially answers the question. We know it's difficult to address expectations, but inviting the right people to address the goal and being very clear about what the goal is and what your external organization's role will be in capacity building, capacity strengthening is also very important.
Thank you. We have time for maybe one or two more questions. Let's see. I don't know, Gail, if you would like to select from the few that we have left.
There was a comment at the beginning of the webinar when we were talking about learning about community systems, around the importance of community structures. I didn't use the word structures intentionally because often that means buildings and health facilities. That's important, but I believe that the comment was really about hierarchy and power and decision making. So yes, understanding those structures is incredibly important. I consider that as part of community systems. If that comment was about physical structures, then yes, community mapping and transect walks and village profiling is also very important to see what exists. So the word structures can be used in many different contexts. I'm using the term community systems to include those decision-making structures.
Thank you, Gail. And then we have one last question that was kind of seconded by another person, but it's kind of a two-parter now. How do you best partner with organizations and deal with organizations who want to compete rather than work as a coalition? And wait, where did that go? I lost it. With regard to goal setting based on reality of area, have you experienced any challenges with donor funding entities with expectations and or approaches to collect data?
Yeah, that is a two-part question, and absolutely, because these are communities are porous, whether they're a geographical community or social network. We're not the only player, and that's a good thing, or it can be a good thing. It could also make things very complicated, and I'm appreciative of your question. I think that sitting down with those other organizations and understanding what their goal is and what kind of community structures, platforms, groups they're working with, seeing where you might be able to leverage and harmonize some of that work is important. I didn't quite get the second part of the question, Carla, about community data. I don't know if you want to repeat that.
Sure. With regard to goal setting based on reality of area, have you experienced any challenges with donor or funding entities with expectations and or approach to data collection?
Yes, yes. The issue of data is going to be addressed in the next webinar. So maybe we can forward that comment into the next webinar to try and address it and try to invite you to join us for that next webinar 3.
Yes. There was the last question that's what I was looking for. It was, how do you give feedback to the community?
It's really important, and that's why And this comes along in other parts of community action, but making sure that that core group regularly uses data, it's very important, to show results. And shares data. And again, this falls into our next webinar on the use of data for decision making. It's also one way to provide feedback on advances made, and continuing to invite participation and to show where things are not working. So oftentimes, even in geographical communities, there are many places there are no longer regular large community meetings. So you would want to try and find out if there are existing community meetings that regularly happen. If not, you work with community leaders, faith-based groups, your informal networks, and that core group would ask to be invited onto those meetings that exist.
All right, well, I think we're about out of time. But thank you so much, everyone, for joining and for your questions. I don't know if Tyler, you want to take it over, and thanks to Gail as well for your video, and yeah. So Tyler, I'll hand it back to you.
Yeah, thank you. Well, thank you all for your participation today. Let's see, let's pull Kim here. Go ahead and log into Springboard to continue the discussion on this topic. We'll be sure to post the resources onto that forum, as well as answer any remaining questions that we maybe didn't get to within this discussion. And also, please go ahead and take a moment to answer the poll questions about today's webinar. And of course, thanks once again to our presenters, to Carla and Gail, and thank you to everyone who joined today. As a reminder, we'll follow up with a link of today's recording as well as the presentations. All right, thank you.